Hi, everyone.
Hello.
So, we are coming to you guys today at lunchtime because it's Halloween.
Trick or treating.
And what an appropriate tagline for today because we get to talk about what's on your face,
Didn't think about that.
right? What is on your face? And so, I'm super interested in this because I think this is one of the coolest topics we've come up with. And I didn't even realize that you could look at somebody other than bags under somebody's eyes to really know what was going on with them, right?
There's a lot of stuff.
I mean, so when you look at somebody, I think one of the first things you notice about somebody is their hair or lack thereof, right?
Are you balding? Are you thinning?
And like that, I think typically just comes from a thyroid issue, right?
Oftentimes, if it's thinning, it can be thyroid.
And then I know, like, the men going bald thing, like, that's a genetic thing, right?
I think that definitely plays a role. I'm sure it also can play like their hormones too. Can
Really?
play a role too.
So, I am excited about this. So, we all know, like, I am Jamie. I get to work here at the front desk. And then this is Dr. Sarah Vivona.
Hello.
And so, we see people all the time and like coming in and out of here. And a lot of times, like, people come here because this is like their last stop. I feel like a lot of our patients here, it's like they haven't found help elsewhere.
Yeah, so they give us a try.
They give us a try, right? And then these end up being our lifers because you guys just work.
Yeah,
Let's just say
great.
it. But there's a lot of things that you and Dr. Colin Kinsale say that is just mind-blowing to me because they're things I just never thought about before. Well, I didn't know to think about them. So one of those is like, is a hot topic for me. So I'm mom, two girls, and their teenage years are now, right? And my one daughter has crazy, just out of nowhere, crazy acne on her forehead. And it's just on her forehead.
Yeah. It's considered normal now too that you're going to get acne during puberty.
But you think that there's something happening inside.
Yeah, I mean, we're actually not supposed to get acne.
Ever?
Not really.
Okay.
So the fact that it's so common that it's become normal shows us something about our health in general. For a couple generations even, and that's now normal. But acne actually, underneath it all, is all somewhat similar. It's showing you just something going on internal. And a lot of times your body's either inflamed or pushing stuff out the skin. Hormones can play a role too. And that's what acne is, kind of like inflamed or irritated pores, basically. Okay. And so Chinese medicine has like face maps and how different locations can relate to different organ areas. And I usually find it somewhat similar in like just kind of testing people and seeing what organs show up. And it kind of matches, most likely. And the forehead oftentimes is like guts and large intestine can show up. So poor diet, which is most teenagers nowadays don't eat very well. And, most that I see teenage-wise, younger, it's forehead is a very, very, very common location.
Her diet is very bad, I actually have to say.
So I'm sure if she ate more real food, that would just naturally kind of get better on its own for that.
Which is, I have to say, since I've worked here, truthfully, I didn't even think about this when we were talking about doing this topic, but I actually just went to an event and I saw some people there who I hadn't seen for a long time. And one girl in particular, like, she looked at me and her other girlfriend didn't even recognize me when I was waving to them. And I haven't seen her since I started working here. And since I've worked here, I have changed my diet a lot. And I mean, I see myself every day, so I don't think anything of it. And they hardly recognized me and just commented on, how much better I look. I didn't think I looked that bad before. But it just goes to show you how much your diet can affect our face, right?
It completely.
So what if it's like cheek area?
Yeah, cheeks depends. It can be like, are you putting your hand there a lot? So like kind of jaw and cheek, it can be that. A lot of times cheek can also be like you're not wiping away makeup clearly enough, so it's kind of clogging your pores that way. And then also, I believe Chinese medicine, it relates it to lung or allergies. And I noticed, like, with me, I have mold allergies, so whenever our house gets moldy, I get little bumps. You can barely see them. I have some now that aren't true like acne, but it's just like these little bumps, and they are definitely there a lot more when I'm experiencing my allergy symptoms versus when I'm not.
Okay.
So it can relate to lung too.
And it's cool hearing you say that, I mean, you're experiencing these truthfully because your diet is impeccable.
Yeah.
I mean, like, they eat so well. And I know, like, Dr. Colin always says that you guys have been eating like that for, like, 5 years.
Mm-hmm.
So it takes some time. But it's just nice hearing that you have some of our ailments, even though, you know, you're normal. So that's cool. What about, like...
Yeah, chin.
Chin.
Chin
Okay.
is another big one. I see this... I mean, it can happen younger, but a lot of patients I see that have acne as an adult, a lot of times it's like here-ish. And that one is usually more like hormones or like reproductive organs. That's like hormonal acne is like the hardest one to get rid of because hormones work on cycles and you normally need multiple like cycles to kind of really see changes.
Okay. Anything else with our face as far as acne goes?
I don't think so.
What about like dry skin? Like, I know a lot of women who are so dry skinned that they're like they get dry patches in the winter.
We were talking about this briefly. It could be dehydration, but oftentimes they're lacking the good fats in their diet, and so you could eat more good fats. And sometimes you actually need supplemental help for that. Could be fish oils, or there's a couple other ones that you can be tested for, because usually you just can't physically eat enough to kind of get out of your deficiency. So that's a way to kind of quickly get out of it and get back to where you should be.
What if someone's like at the opposite, where like they're too oily?
Mm-hmm. So
because that wouldn't mean they're overly hydrated, right? So
I think that could partly be genetics, depending on like where they hail from.
Where they hail from?
Is that how you say it? Because if you think of like dry climates, their skin might want to produce more oil to combat the dryness versus, if you live in Scandinavia, you might not need it. So part of it, you might just have more oily skin. And also, I find, like with mine's more oily, that if you just kind of let it do what it does, it kind of evens out into, like, I don't know if anyone can tell my skin's oily, but I don't do anything special to it. I don't wear anything special for it, but if you touch it...
I can never tell your skin's oily.
It's oily. And I don't do anything, so just kind of, you get healthy overall, and your skin will kind of even out into what it's meant to be.
Now, you and I'm going to go backtrack a minute, because you and I have talked about hair before, because this is so interesting to me. How often do you wash your hair?
Well, I'm straight. I don't know if I want to say. Not very often.
You really don't?
No.
And so I've been, looking into this about, like, how often women should wash our hair. Because, I mean, we have natural oils that we really shouldn't be throwing chemicals. Yes, right? To wash our hair every day or even every other day. And most of us do that.
Yeah.
Yeah. And our bodies adapt, right?
They do. Yeah. For a period of time when I was keeping it curly, my curls like water just because then also get frizzy. And so I was then washing my hair every time I was like wetting it, and I found that it got really like dry, and so I stopped doing that, but I was still like just wetting it, and it definitely had to transition back because it would get itchy and stuff if I didn't do it every day, and then it got like longer and longer, and now, I mean, I don't want to say how long I can go, but
but you can go a long time.
I can go
because
a long
your hair
time.
You're dry. Your hair is dry, right?
My hair is really dry. I put oil in it every day.
And I noticed, like, even like lately, like I used to wash my hair every other day, and now I'm pushing that further and further back. And when I first did it, it didn't work so well. But I can see my body adjusting to a change of like a 2-day no wash.
Yeah.
It's amazing.
Yeah.
It's really cool. I know she was not expecting that.
Guys.
And she still didn't answer the question, but we're going to let her go with it. All right. So I love eyebrows. If anybody knows me, I'm such an eyebrow fanatic for some reason. Everyone has a fetish, right? But you have something you can tell about someone from their eyebrows.
Mm-hmm. So if your eyebrows are thinning, tends to be more on the outside edges. It's like hallmark for thyroid, hypothyroid.
No way.
Now you'll be watching people and you'll see.
I don't have any.
There you go.
I don't have any on the outsides of... I don't have hair on the outsides of my eyebrows. So that's amazing. So I'm proof that works then.
Mm-hmm.
That's awesome. So we always look at eyes.
Yes.
Right? I actually just saw a commercial and I thought it was the craziest thing. It was for a drug commercial. And it was about getting drops to make your eyes whiter.
Ooh.
And it wasn't for anything medical. It was simply cosmetic.
Yeah.
And, then it went through a list of side effects, of course, to make your eyes
Maybe
whiter. So I'm super interested as to what you can tell from our eyes.
So there's two main things. So the first one is very obvious. It's when your eyes turn yellowish. It's indicating like more liver, kidney problems. They're not draining the way they should. And so toxins are kind of getting backed up. So when you see that, you need to evaluate liver or kidney.
Okay. So don't go buy drops to make your eyes white because, that's really going to screw up what's really happening inside to make that apparent, right?
Yeah, and those are two really important organs. So you don't want to just mask what could potentially be going on until you get to like a serious problem and then need like dialysis or something else crazy done. It's better to fix it while it's just kind of tired as opposed to just not working.
Okay. And then, of course, we all know if you have bags under your eyes, this is a tired, right, fatigue thing.
Could be. That would be more like if it happens once in a while, like if you don't sleep, then that's probably what it is. If they're constant puffy bags, and if you look down the street, you're going to see lots of people that have just pouches here. And it can happen a little bit with age as, skin stops being as strong. That can happen, but not as puffy as like little clouds under your eyes. And that is more indicating like lymph drainage, liver drainage, overall inflammation. That whole pathway isn't working right. And so you need to, if you correct those, the bags would kind of disappear. And then dark circles, which I did post a picture on. No one commented. I liked that one. They all commented on the gross picture. But if anyone has dark circles on their eyes, yes, if you don't sleep, you can get some, but more like chronic, all the time dark circles is more like gut and liver health. It's a big sign that something's not working.
Okay. And then we'll just keep going down our face then. What about our nose? I never even noticed people's noses, that a nose could tell you something.
So if the tip is reddish purple, it's cardiovascular, heart. And you see a lot of this in like older populations. I usually see it in like older guys, like grandpa age. You normally see their noses ruby red.
I initially thought of Santa Claus.
Yeah. So is Santa healthy?
He had a big belly and he eats a lot of cookies and milk.
So he probably has heart problems.
All right. So how about lips?
Yeah. So just dry lips could be dehydration, for one. Another thing, if you put chapstick on all the time, it's just like your hair, where your body stops producing its own moisture, I suppose. And so if you do that, you're going to go through that period of time where they're just dry and uncomfortable, but eventually that will even out. And then the picture, that gross picture we shared, and if you haven't seen it, definitely go check it out.
Sounds wonderful. Don't you all want to run and see this disgusting
should.
picture?
It's not that bad. But if you people can get cracks in the corner of their mouths, or even like their tongues also can kind of get irritated, and that's usually hallmark of like B vitamin deficiencies, mainly like B2. Um,
But
so
only in the cracks?
for B2, yeah.
Okay.
A couple other ones it shows up more in like tongue irritation, burning, or the taste buds kind of change shape.
So what about so now that you're speaking of like tongue, like what about your tongue? Like I know there's some things with white tongues. What should your tongue look like? Pink, right?
Pink, yeah. It will have a little bit of a white film just because that's part of like our mouth bacteria. But if you ever see anyone has like that thick coating of white, that's more of like a yeast problem, sugar metabolism problem, and that's definitely not healthy.
So what about gums?
So if your gums are pale, you have some sort of like, I don't want to call it iron deficiency, but like anemia that should be checked. Blood, it's not right. Usually it leads more towards iron, but you know, a lot of things can change that. And then if your gums bleed a lot, especially when you brush them, it's usually vitamin C.
I don't want to smell now because my gums are white, but I do have an iron deficiency, which this is the coolest thing we know because you did something to my eyes one time when I suggested I had a history of an iron deficiency, and you were like, well, let me see the inside of your eyes.
Yeah, you can do that, or gums. You can do like your nail beds too, but this is harder to see.
What would they look like?
They should be pink.
So, okay, inside of your eyes would be like whitish,
under
right?
the eyelid, and then in your gums.
Okay. I'm not doing that. You're not answering the hair, and I'm not showing you my gums. Okay, so we did have a question. So, and I can't even say it. What about
Oral facial dermatitis.
So bumps on the corner of your eye, nose, and mouth.
I'm not as familiar with that, but generally all skin conditions are from something internal. So it would be checking out guts and liver and kidneys, any sort of drainage pathway that should be working. If it isn't, the body will usually throw things out, lungs first, sinuses, and then skin if it can't get it out. So that would be my first step. And then kind of just seeing what shows up and what progresses, whether it's something like that or something actually in the skin.
So, okay, so now that we figured out, okay, when you look at people, these are things that you're looking at as even as part of the exam that you and Dr. Collin do, right?
Mm-hmm.
And then these are just signs that there's an organ system, something's wrong with that organ system.
Yeah.
So it's not a sign that you guys need to go out and buy vitamin B or vitamin C, right? So the best thing for you guys to do, if you see any of these symptoms in you, if you have a kid like I do who has acne, I'm not going to go buy her some anti-acne cream that's going to cover up what's happening inside.
Mm-hmm.
I'm going to bring her here so that we can figure out what's going on with her gut and we can fix her from the inside out.
Completely.
To not cover it up. And I'm such an advocate for just not covering any of the things that we talked about up with more chemicals,
mm-hmm.
because it's just going to get worse, right? Because if we don't treat the problem,
right,
it's just going to get worse and worse. And so if it's a cosmetic issue, I always think like, wow, if I'm having a problem with how I look now and I don't fix it, I'm really going to have a big problem later. Right? So one of the best ways for you guys to find out what is happening or what you need to fix that problem, not just cover up a symptom, is to come in and see you and Dr. Collin.
Yeah, just, you have to do your exam, get a clear picture of what's going on, and then figure out, is a good fit for you, and we'll figure out if we're a good fit for you or vice versa, and let you know completely, like, this is what's going on, this is how we would fix it, and then we proceed.
So if you guys are interested in coming into the office, you can always reach us at 724-205-6260. And if you're just interested in getting to know the doctors a little bit more and wanting to find out what techniques they're using, and scientifically why these techniques work, how they work, you guys are always welcome to come to a Wednesday night class that we have every Wednesday except for tonight because of Halloween. And we want you guys to enjoy your families. So you are all welcome to come to this class. And you guys give a huge discount for this class.
We give half off exams.
Half off for the exam, and the class is free. So it's just because these doctors want you to be educated and comfortable with coming in to see them before you make a commitment to being here for your wellness. So thank you guys so much for joining us, especially at lunchtime today. And happy Halloween.
Bye.